Hi guys! Today I wanted to talk a little bit about the difference between Cushing's disease and Addison's disease, since that seems to cause a little bit of confusion. Addison's disease, or hypoadrenocorticism, is a condition caused by the lack of cortisol production by the adrenal glands. The adrenal glands are small little, almost kidney bean shaped organs right by each kidney, and they have a number of functions. One function is to produce cortisol or cortisone, which is the stress hormone. They also produce a mineralicorticoid that is responsible for salt and water balance, so essentially making sure that the kidneys are able to regulate salt and water balance. And then they also help with some sex hormones and adrenaline. In dogs in particular, we can see an autoimmune condition where basically the adrenal glands, the first layer or the first two layers, can become destroyed, and that can result in either a decrease or actually almost a complete wipeout of cortisone or cortisol, or we can see a complete wipeout of the first two layers, which results in no production or decreased production of cortisone or cortisol, and then that mineralicorticoid, that salt and water balance regulator. So these patients, when they don't have these hormones necessary, they really can become lethargic. Cortisol, the stress hormone, is really important for gut function, so they can have vomiting and diarrhea. If they don't have that mineralicorticoid to help regulate salt and water balance, salt goes out of the kidneys and right behind it goes water, and so they tend to get really dehydrated. These patients can have abnormalities on their blood work. So I mentioned dehydration, meaning their kidney values can go up. Their salt and water balance, sodium and potassium, can become really abnormal. We also can sometimes see white blood cells actually being normal, which in a stressful situation is actually very abnormal. You want to have increased white blood cells to take care of any sort of infection. So these patients can get really sick. What's hard is that these changes and these clinical symptoms mimic a lot of other diseases. So gastrointestinal diseases like inflammatory bowel disease, bacterial or viral gut infections, kidney liver disease, toxins, medication side effects. So all of these things can look very similar. And so Addison's disease has to be on our radar for really any sick dog, and it's something that we need to test for. Abdominal ultrasound can be helpful to look at the adrenal glands and see if they're small, but really the diagnosis comes with a test, a blood test called an ACTH stimulation test. And what that test does is we give a medication, draw a blood sample to look at cortisol levels. We give a medication that's designed to get the adrenal glands to produce as much steroids or cortisol as they can. And if they're having a flatline response, meaning that they can't increase their production of cortisol, then that gives us our diagnosis. Treatment is actually giving that cortisol back to them, and so that's actually prednisone that we use. Now, during stressful times, so meaning when they're sick or if they get any other conditions, we use a higher dose, like a stress dose of steroids. Maintenance is actually a physiologic amount of steroids, so just what their adrenal glands should be making on a day-to-day basis. So what we expect in these patients when nothing is going on at home and once they're starting to feel better, the steroids that we're giving them shouldn't cause any side effects. So if you think about it, we're really just replacing the steroids that their body should have been making anyway. So we just have to give that to them continuously for the rest of their life, because they'll never regain that adrenal function. If they're one of the lucky patients that has both layers of their adrenal glands destroyed, meaning that they need both cortisol and the mineralicorticoid to help with salt and water balance, those patients actually need an injection. You may have heard of DOCP. It also goes by Zycortal or Percortin. Those are synthetic forms of that hormone. And so those patients that have the classic form of Addison's disease need that injection as well for the rest of their life, and that can be pretty expensive. The other disease that I quickly want to mention is Cushing's disease. And this is essentially the complete opposite. So this is when the adrenal glands are making way too much cortisol, so way more than what you would need on a day-to-day basis. And these patients can develop this condition either when they have a tumor on one of their adrenal glands, or if they actually have a nodule on the pituitary gland in their brain. And so what happens in those patients is that, those lesions cause the adrenal glands to produce way more steroids than they should. And what we have to do as far as, looking for it, obviously we need clinical symptoms. And the clinical symptoms of those diseases are what you would expect with too much prednisone: increased thirst, increased urination, panting, ravenous hunger, like breaking into the trash can, breaking into cabinets trying to get something to eat, panting, and then we also can see some skin issues. So they tend to have a lot of skin infections and hair loss. So we need really a clinical syndrome. We need to see those clinical signs before we'll even test these patients for Cushing's disease. Now you may ask why. Now, if you think about it, cortisol or steroids, they're going to go up with any sort of stressful event or any disease. So if we have a patient that's displaying these symptoms, now those are the patients that we want to test for Cushing's. If they're not having any symptoms, how do we test? How do we know what our tests mean? How do we treat? If there's no symptoms to treat, how are we going to know that our treatment's working? So really, these patients with Cushing, this should be very obvious. Sorry, there's my dog again. We're having our couch time cuddle. But for Cushing's, the testing that we want to do, there's a number of tests. And whenever there's more than one test, that means no test is perfect. So imaging the adrenal glands can be helpful with like ultrasound. Actually measuring the cortisol levels in the urine. That can be a test that we can use to screen for it. The definitive tests are going to actually be a test called an ACTH stimulation test. So in this case, unlike for Addison's disease, we're looking for too much steroid. So we want a really, really high response. The other test that we can do is called a low-dose dexamethasone suppression test. And that's actually a test that we're giving steroids to get the body to suppress its production of steroids. So if you think about it, in a normal person, dog, or cat, if our adrenal glands are working fine and we give extra steroid, well, now our adrenal glands don't need to make that steroid because we just gave it. And so we should see that our normal levels of cortisol or steroid should drop. This is not the case with patients with Cushing's disease. Those patients really just don't have a response. These are dogs that are just producing too much steroids and they're not listening to what the body is saying. So we'll see that they don't suppress. The treatment for Cushing's disease is if there's an adrenal tumor, you actually can take it out as long as it's not invading into blood vessels or any sort of major structure. And then medical management, which is giving a medication that actually is going to inhibit the adrenal gland's ability to make steroids. And so you may have heard of trilostane or Vetaril. That's kind of our mainline therapy. Again, if patients aren't clinical for Cushing's, we don't test, we don't treat. If these patients are sick and we think maybe before they got sick with a kidney problem or a gut problem, we think maybe they had Cushing's disease and now they have a second disease, well, we want to treat that second disease first. We want to try to eliminate anything that's going to have an impact in our test. Now, if we do decide to test, again, we want to pick the right patient. So we want to pick a patient that has symptoms relating to Cushing's disease. Ideally, they wouldn't have anything else going on, no other diseases that are going to factor into our test. And they also would not be on steroids. We can't test a patient for Cushing's disease that is receiving steroids because that is going to affect our test. That's going to affect how our adrenal glands respond to the testing for Cushing's disease. Once we get a positive test in a patient that we believe truly has the disease, what we're looking for really is a clinical response. We also want to make sure that that clinical response is backed by testing to show that we're not cutting back their steroids too much. Everyone needs at least a little bit of steroids to carry out day-to-day business, for gut function, for waking up, going to sleep, all of that. And so we want to make sure that when we're treating these patients, that we're not treating them to the point that they become Addisonian or have a flat line, almost negligible cortisol level in their bloodstream. We just want to have it low enough that their symptoms of increased thirst, increased urination, ravenous hunger, panting, skin disorders, we want to make sure that those things go away without, again, cutting back so much that there's no cortisol or steroids left in the body to help them cope with day-to-day life. Once we get them to a point where we feel like clinically they're doing well, their blood tests are showing that if they needed to produce more steroids, they could, then we leave them on those medications indefinitely. But we always want to come back and just circle back, make sure regularly that the patient's doing fine. We want to make sure the blood tests haven't changed. And then the other thing I always tell people is if your pet gets sick for any reason, talk to your vet, but I often recommend stopping the medication for Cushing's disease. Because in a lot of cases, those side effects of Cushing's, if we allow the symptoms to come back, sometimes that actually helps that patient through whatever the acute crisis is. So for instance, if they have a surgery on their gut and they're not eating very well, taking them off the Vetaril or the Trilostane for their Cushing's could help their appetite quite a bit. And so there's never a harm in stopping the medication. We can always restart it, but during any sort of illness, it's helpful to take those medications away for the Cushing's so that we can help them get through the crisis, get back to their normal baseline, and then get them back on the treatment for their Cushing's disease. I hope this all makes sense. Again, if you have any questions, let me know. Any feedback, any ideas on content, let me know. But again, thanks for joining me. Appreciate it.